Hey, okay, this is the narration for the nervous system PowerPoint. We're going to go ahead and get started, and I hope you guys can hear me okay with this microphone that I'm using. So we watched the video by Bull Harrier on YouTube from the nervous system, and we're going to go ahead and get started with what was actually covered in the text, okay? If you have any questions, please either email me or contact me via text, either one. And as Bull Harrier talked about in the video, we have the central nervous system and the peripheral nervous system, and hopefully some of this will start to come back to you guys. The central nervous system is kind of like he talked about the CPU, and that consists of the brain, the spinal cord, and in your text it also does say, I want to make a note, it's different from what he said, but it includes cranial nerves 1 and 2. And then the peripheral nervous system is also divided out into the cranial nerves, believe it or not, 3 through 12, the spinal nerves, and the peripheral components of the autonomic nervous system. So just remember that they obviously work together to kind of make up the entire nervous system, and you have the messages being carried from the peripheral nervous system to the central nervous system, just like he kind of compared it to the computer with the CPU, okay? Okay. So I tried to make detailed notes whenever he went through the lecture on YouTube the other day, and so I may repeat some of that. So we have the cells of the central nervous system, and these are covered at the very beginning of your chapter. And just remember that neurons are the primary functional unit that you want to have in your memory from the nervous system. And there are 3 characteristics that they're all going to share, and that was actually one of the questions from the group that presented the questions for us. Those 3 characteristics are excitability, conductivity, and the ability to influence other neurons, muscle cells, and glandular cells, okay? And we know that the neuron, I think I have a picture on here, I may not, but consists of the dendrites that receive the nerve impulses from the other neurons, and then the axon that actually carries the nerve impulse to the other neurons. And remember, he talked about that can either be myelinated or not myelinated. And then we're going to go down, we have the glial cells that he talked about. Those are going to provide support, nourishment, protection to the neurons. And there's several different types. We talked about that a little bit as well in the video. The oligodendrocytes are mainly for support. The Schwann cells form our support, and they also form support for the myelin. The astrocytes, remember he talked about those, and that was also part of some of the questions that were asked. And those help form the blood-brain barrier. They are the most abundant, and they are, remember he talked about how picky neurons are, and so those actually help form the health. They help with the health of the neurons. And then the microglia are kind of like the phagocytes. They go through and clean out the bad cells or the dead dying cells, okay? Okay, so we talk about a nerve impulse, and there's another additional video that he lists on there with the actual action potential and all that goes through. And if you're interested in that, or you're having questions of that, or that forming in your mind, I would highly recommend that you look at that that video. I'll try to go ahead and post it up on the content, okay? But we know that there has to have an action potential in order for that message, whatever it is, to travel along that axon, okay? Once that action potential is achieved, then the nerve impulse travels down the axon to the end of the nerve fiber, and it will cross the synapse. And it will either go via a neurotransmitter to another nerve cell, or to wherever, maybe it's an end organ that's going to respond, but wherever that nerve is ending, that's where that synapse will lead to, okay, that message. Okay, so the synapse, there's two different types, chemical and electrical, and that's the structural and functional junction between the 2 neurons, okay? And then the neurotransmitter is the chemical that affects transmission of the impulses across the synaptic cleft. I always want to hit end for next. I hope that works, but okay, so continuing on, we're going to go through the basic anatomy. We've kind of gone through how everything's functioning. Very complex. You guys are getting just a very, very highlight of the whole entire system. So if you have a question about anything, like I said, contact me, and I'll also probably refer you back to those great YouTube videos as well. So he covered a little bit of this on the video, and then let's see. This talks about the ascending and the descending track, so how this stuff is going. And he divided it into the afferent and efferent. And remember, afferent was moving towards the central nervous system, and efferent was having moving outward toward the muscle. Okay, so remember that the cross-section, if you went through the cross-section, this is what you're going to find. Okay, and there's those different tracks that are in there as well. So the next slide, we're talking about lower motor neurons and upper motor neurons. This is just strictly what the text says. Basically, it's just as what it's saying. Okay, so you've got the lower. Those are the final pathways through which the descending motor tracks are going to influence the skeletal muscles or whatever is going to be reacting. Those are on the anterior horn of the spinal cord. And then you have the upper motor neurons. Those are going to project downward, and they'll influence skeletal muscle movement as well. And it talks about the different types of, if there's a lesion in that area. The best thing to do for these, I think, my opinion, is to put them on a note card, and just this is something that can be put to basic memorization. Okay. He also covered the reflex arc when he was talking about certain responses to different stimuli. It's involuntary response. You will have to know the different reflexes that are involved. Remember, you guys did this in Health Assessment 1. There's the brachial, the radial, the biceps, the patellar. So all of those, make sure you go back and that you guys look at those as well, okay? And then this is just a picture describing exactly what you're going to see, where you have the nerve with the connected onto the tendon there, and then how the reflex doesn't go all the way up to what we're calling the CPU or to the central nervous system, but it's actually just going through that horn on the spinal column there. Okay. So in your head, think when you see this picture, so what, if I saw that picture on my test, what reflex would that be? And that would be the patellar reflex. Okay, so we're going to be dividing out, again, we went through the spinal cord, and now we're going to get dividing out into the brain. So these are the basic sections following along with the book, and there's the cerebrum, and it's divided into the right and left hemispheres. And then also what's included in that cerebrum is the basal ganglia, the thalamus, hypothalamus, and the limbic system. And I know that we have talked a little bit about a portion of this before, but the hypothalamus is located just inferior to the thalamus, and it's just in front of the midbrain. And we know that this is important because of the regulation of the ANS and the endocrine system as well from our last unit, okay? All working together. It's just one big machine all working together, and if one part fails, it's going to affect all the other systems, okay? So that's how these two are connected, as well as where the nerves actually end up in some of these organs. The limbic system is located near inner surfaces of the cerebral hemispheres, and it is concerned with emotion, aggression, feeding behaviors, and sexual responses. We talk about the basal ganglia is on here as well. And then the thalamus is on here as well. Please commit those to memory. I can guarantee you that you will have at least one of these on your test where you will have to have basic understanding of what that area of the brain or whatever portion of that brain is going to be affecting. Okay, so that's going to be critical for you to remember, especially when you get down to disease processes. That's going to be really, really important. This is very important. The hemisphere is divided into the four lobes, the frontal, temporal, parietal, and the occipital. And this lists out for you on this slide. I won't bore you by reading it, but it lists out for you exactly from the text what's responsible, what area has what response, okay? So basically, occipital lobe, processing of sight, those kinds of things. When you think about the cranial nerve coming in and all those nerves involved, what is functioning with that? Where is that going to in the process of how sight works? Table 56.2 also provides a good summary. I would certainly commit these to memory, okay? There's the picture of that, so in case you need a visual image, there you go. Okay, continuing on with the brain, we have the brain stem, and that contains the midbrain, pons, medulla, cranial nerves are in there as well, a couple of those, and the reticular formation, which is important because you guys talked about the reticular activating system in level 1, and that's basically, if you'll remember, in the section for sleep, remember that functional health pattern, this is responsible for the sleep-wake cycle and arousal, okay? Communicates with the brainstem, the reticular formation, and the cerebral cortex. So essentially, the reason you're learning all of these again and committing them to memory, hopefully that you don't lose over the summer, is that you guys will have to know if a disease process or a lesion or an injury happens in a certain area of the brain, how is that going to affect that patient, and what is that going to look like for that patient, and how is that going to determine what care they need. So that's really, really important, okay? Reticular formation is going to relay sensory information, influences the excitatory and inhibitory control of the spinal motor neurons, and it controls the vasomotor and respiratory activity as well. So that would be important if that was knocked out or there's a lesion there or an injury. Think about that, the respiratory activity, okay? Okay, now we are down to what I think is a really cool and interesting area when you get into the CSF and the ventricles and all of that cool stuff. Cerebellum, it's in the posterior part of the cranial fossa under the occipital lobe. Voluntary movement, maintains trunk stability and equilibrium, receives a lot of information as well. You look at that. And then these two next ones, the ventricles and the CSF, they're kind of indented in as if they're under the cerebellum, but they should actually be pushed out to the side. Sorry, I forgot to fix that. So there's 4 ventricles in the brain as well, and then you have cerebrospinal fluid. So those 4 ventricles are filled with fluid as well, and they connect to each other. As you can see, I think I have a picture of a CT scan further on. And so you'll see how those connect in that. And then the lower 4th ventricle actually becomes a central canal and the cerebrospinal fluid circulates around. That's fluid that provides cushioning for the brain and the spinal cord as well as nutrients. So that's really important when you go further on into the unit looking at diagnostic data. That's really important in kind of giving us a picture or a portion of the picture as to what else we can gather that could potentially help us diagnose a patient or treat them, okay? So think about in your mind, if you have a perfect amount of fluid in your system, which we know should be about 135 mils, okay? So if you have too much or too little, think in your mind how that could potentially affect a patient as well, okay? So we're going to get out to the peripheral nervous system, and this is just the basic slide. I think we got a few questions from this class once in Health Assessment 1. Did you guys have to know the different areas of the, excuse me, dermatomes? And that, in case you missed that in Health Assessment 1, was the areas that are innervated by specific nerve fibers of dorsal roots off the spinal nerve. So there's certain areas coming off of that spinal nerve that is responsible for innervating certain areas. Usually there's a chart. Further on in these chapters, there should be a chart as well. Okay. Hey, remember these? These are those cranial nerves. You guys are going to have to remember those. However you thought to remember those, whatever mnemonic you used is just fine, but you definitely need to go back and review these. If you have your little note cards that you used, if you had your mnemonic, please go back and remember you are going to be tested over this. This will be something you continually have to know throughout the whole program. So go through, there's table 56.3. Some of these are going to have sensory fibers, some are efferent fibers, some of them are both. So some are motor, sensory, motor, not sensory, sensory, not motor. So we won't get that specific with our testing, but just know that that's how that works, and know that you're going to have to know cranial nerve 1 is, what is it, what it does, and how you're going to test it, okay? Just as you did for the checkoff in Health Assessment 1. So now we're going to go down to the autonomic nervous system. So that controls involuntary functions of the cardiac muscle, smooth muscle, and glands. Remember, this is one of those mix-ups that he said in that initial, or it was in the second video that we watched. So think of this as well, because you guys are studying some, you're studying deeper into some of the medications that you give patients. So think about smooth muscle and how certain medications that you guys are already studying acts on that. Okay, so just as an example, think of where you see smooth muscle. Where obviously we know where cardiac muscle is. How are those affected? They're in the autonomic nervous system by medications, okay? So they're sympathetic and parasympathetic, and we know that sympathetic is kind of like the racer, okay? It's fight or flight. Norepinephrine, acetylcholine, so you kind of have an increase in your heart rate, increase maybe in your blood pressure from that. That's fight or flight, so think about that one, okay? Like what happens, as he was talking about, whenever you're driving in the car and someone cuts you off, okay? Fight or flight. Oh, and that previous one too, that was also one of the questions, the preganglionic cell bodies, where they were located. That was one of those questions on that PowerPoint that was done so well by that last group there, okay? So this is the slide for parasympathetic nervous system. So I always kind of think of this one as being the calmer, so it can serve and restore energy stores to the body. So if let me flip it back here. Sympathetic is the thing that kind of ramps everything up, increases, all that stuff. This is the one that kind of decreases, okay? So there you go for that one. We also know sometimes you don't even like really consider it, or you think about it, you know blood goes through the heart, and we've talked about that, but you just don't oftentimes stop to think that blood has to actually flow to the heart as well to make it work. We know that the blood, the brain requires a lot of that. We know CSF is flowing through there, and that's providing nutrients to certain areas, but we also know that there has to be a blood supply also to the brain. So this is how that works. This would be a great index card for you guys to just be able to commit to memory as well. There's the internal carotid arteries. They provide flow to the anterior and middle portions of the cerebrum. And then the basilar artery, okay, comes out of that. And then the vertebral arteries as well. Okay, so I would make, I'm not going to bore you by reading all of it. I would make a note card and then try to commit that to memory. This is something that you'll hear more and more about. This is an area, vascular area. It has safety, in quotes, it is a safety valve for regulating cerebral blood flow. Okay, kind of know what that is. And then he talked a little bit about the blood-brain barrier. He talked about medications that have to be in order to be able to cross that blood-brain barrier. So we know that that blood-brain barrier protects the brain, and so it protects it from harmful things, but it also allows nutrients and gases to enter that are required. And we just have to pay attention and know that lipid-soluble drugs are the only drugs that can enter or can cross that bloodstream, blood-brain barrier, okay, from the bloodstream. So just remember that there's that physiological development of that blood-brain barrier. think I'm skipping ahead on my pages on my notebook here. Okay, so I think I had a really good picture of protective layers there. We're talking about, so we're going to flip back this way. Meninges, there's the 3 layers of the membranes that surround the brain and the spinal cord. Know these, there's the dura, the arachnoid, middle layer, and the pia, which is the inner layer. Okay, I'd commit those to memory. It's probably pretty darn good test questions there. And there's a picture for you in case you need more of a visual illustration. Okay, we know that the skull is just like the ribs to our heart and lungs, and the skull protects our brain from external trauma. There's those 8 cranial bones and 14 facial bones. Okay, foramen magnum is very important because that's where we get a lot of the important things coming from our brain there, like our brainstem and spinal cord. Vertebral column is going to be protecting that most important spinal cord. It also provides some support to the head and, as you learned in your range of motion, some flexibility. So I would certainly remember, this is back to your anatomy class, about how many bones make up the cervical area, how many are in the thoracic area, how many are in the lumbar area. So please commit that to memory if you've forgotten. Once again, know that there's those intervertebral discs in there that kind of help provide the cushion there between the vertebrae as well. On to those gerontological considerations, I'm going to request that you guys really pay attention to Table 56.4. There's a lot that goes on with us as we age, so we definitely need to pay attention to that. Remember, one of those things, too, is that everything seems to just kind of slow down, even someone's speech. So as you take care of older patients, just please remember that they may not be as quick to answer as you or I. They may need a little more time to be able to mobilize or to respond to questions, okay? So a lot of what is happening is a lot of slowing down. In addition to things that we've mentioned in previous chapters and previous units about, like we've got here, changes in smell, okay? They may not have exactly the same reaction time, such that may affect their driving. Changes in the memory, vision, hearing, okay? All of that's going to come into play with these older adults. We have all that important health information. Past health history is really, really important. Remember that these patients may not always be the best historians, so definitely want to question the family or a primary caregiver to these patients as well. Of course, we want to pay attention to that patient, but make sure that you are getting the accurate picture from a good historian, okay? Try not to ask certain leading questions. Make sure that your questions are open-ended. Like I said, provide lots of time for the patients to answer. Medications are very important, especially those sedatives, opioids, tranquilizers, and mood-elevating drugs. Surgery. Have they had any injuries to their head, spine, or any type of sensory organs? Maybe they have an unusual growth and development history, so we want to pay attention to all of that. On to those functional health patterns. I'll let you guys read through these on your own. Very, very important, health perception, health maintenance. They went through a lot of this in the text. That's kind of a longer area to read, but very, very important. Anything from substance abuse to seatbelt history, we really need to be paying attention to, because that can affect the neurological history or status of a patient, okay? Nutrition, metabolic, we know that neuro problems can happen due to inadequate nutrition. Thiamine, niacin, pyridoxine, sorry, I'm not the best at pronouncing that, can cause depression, apathy, neuritis, weakness, and mental confusion, irritability. And then want to pay attention to that cobalamin as well. Elimination. You know, it's really easy to overlook this, but you think if a patient is having some sort of issue causing paralysis, they may not be able to control what's, their bowels or their bladder habits. So this is really important, but you really want to determine which came first. Did the neuro problem happen first, or did an elimination problem happen first, okay? Can these patients, talking about activity and exercise, can they get around in order to perform their ADLs? What is their mobility? What is their strength? Are they coordinated enough to participate in their ADLs? All of those things are very important to factor in. Sleep rest. Are they experiencing paralysis to the point where they're unable to reposition themselves at night? Is pain and discomfort so limiting to them that they're unable to have a good quality sleep? Cognitive perceptual, well, goodness, that's kind of where we are right now. So make sure that that's all factored into all these questions. And you want to assess for delirium as well. There's a little bit about that in your text. Self-perception. Are any of the changes related to their neurostatus affecting how they feel about themselves? Okay, that can be kind of a sensitive issue and need to assess for that. Very, very important. Role relationship. How do these changes that have affected their neurostatus, how is that affecting their role? And don't forget that there are several roles, and we have them listed here as employee, spouse, and parent. Those are just a few roles that may affect their ability to feel good about themselves or perform. So we're kind of intermingling a few of these, which is why we don't ask a lot of questions about those. Sexuality, reproductive. We know that neuro changes can affect sexual satisfaction. Tread lightly on this one, and it's one where you definitely want to assess for it, but you're going to have to ask some intimate leading questions for that as well. So coping, stress tolerance. Maybe this is going to force them to develop different coping techniques and strategies. So we want to make sure that they actually have a really good support system in place. Values and beliefs may cause a stress on that belief system, and then make sure that any type of religious things that they're participating in may not affect any of that treatment. Okay, so on physical exam, I used to always talk a lot about this in health assessment one, but mental status. So you're looking at general appearance, behavior, cognition, mood, and affect. So if you walk in and it is the dead of summer and it's like 120 degrees outside, are they wearing a trench coat and heavy boots? Are they dressed appropriately? Make sure that you're factoring all of that in, okay? Are they responding to you? Are they alert and oriented times 4? Are they actually able to answer your questions? Are they crying? Are they very stoic? Cranial nerves, throw those things in here again. You want to assess all 12 cranial nerves. The motor system. Remember how you guys went through and you did that range of motion? That's essentially what you're going to do here as well. It's that range of motion again. You want to assess for strength, tone, coordination, and symmetry of the major muscle groups. So how did you guys do that? So remember, stick out your arm right now. Stick your left arm out in front of you. Flex up that arm. So remember how you guys did that? You would have someone pull against your arm, push against your arm. Okay, so you're testing the strength. You can also look at the muscle tone to see if the tone is equal in both arms. Okay. Make sure all areas that you can test, like shoulders, wrists, elbows, fingers, hips, the spinal column, the neck, knees, ankles, toes, that all of that is tested for strength as well, okay? You want to watch them walk. Do they walk alternating right leg with left arm, or is that somehow not as coordinated as it should be? Speech. You also want to listen. Are they actually able to speak? Are they articulating clearly? Do they appear to understand what you're saying? They just can't respond. Okay. And then that darn Romberg test again is coming in here. So, and I think we go into that a little bit further on here as well. So sensory system, you want to have them close their eyes, and you want to test for several things. Touch, we have that cotton wisp. You can do sharp and dull. You can do cold and hot. You can get your tuning fork and hit it and make sure it vibrates and see if they can feel that. But you want them to close their eyes, and don't ask them, is it sharp or dull? Make sure they close their eyes and say, how does this feel? Okay, you want to start out towards the hand and work your way into the trunk of the body. So obviously distal to proximal, and you want to test all extremities as well, okay? And then the reflexes, bicep reflex, tricep reflex, brachioradialis, patellar, and Achilles tendon reflexes. Excuse me, know how you're testing those and then how they're measured. Probably actually put that on a little note card here again. I probably should own stock in those note card companies. Okay, so now we're going to go to those diagnostic tests, and it would be my hope that at some point in your clinical experience already that you may have had some experience with this, and maybe not, but these are certainly things that are really cool for you guys to pay attention to. Cerebrospinal fluid, we talked about that a little bit when we talked about the basic anatomy and physiology of the system. So normal CSF should be clear, colorless, free of red blood cells, and contain very, very little protein. So see table 56.9. You want to know about CSF because this is going to come back to you a lot in those next chapters that you guys are going to go through in adult health, okay? So how do you get cerebrospinal fluid, or CSF as we call it? Well, that's by lumbar puncture, okay? And a lot of what we do here, a lot of what we test over, remember that nursing responsibility is very important. So this is what you want to know. Have the patient empty their bladder, and then normally they want to lay on their side. There's the sterile needle that goes through usually the first and second lumbar vertebrae, and that's where that specimen is going to come out. They may have pain that briefly radiates down their leg, but that's normal, and it should, keyword there, should go away. You want to monitor them for headache, meningeal irritation, and signs and symptoms of local trauma. That should be of. It says or, but it should be of. And just remember, so what is that? Maybe bleeding at that site, bruising, okay, irritation, pain. So that's especially for the headache, okay? That's very, very important to monitor for CSF. We talked about if there's too much and if there's too little. Okay, so if there's too little, that's something that might happen as a headache. A CT, and I think I have some example of pictures on this PowerPoint as well. The CT is computed tomography. It's really cool. It's really fast. It's a really great way to be able to look at the brain and several other areas. But when we're talking about the brain, it can provide 3D images of intracranial components, and it can be done with or without contrast. Okay, so remember that, with or without contrast. We know that contrast has to be filtered out of the body somehow, so that's very important. But it's very, very quick. There's some pictures for you. I wish I had a pointer on this thing, but down there on that second row, you can see the ventricles there, the darker area. It's really cool. Okay, we also know that in the same category as that CT is the MRI, and it'll actually provide a little bit greater detail because it has a higher resolution, but it's going to take a lot longer time. If you've never had a CT or an MRI done, the MRI takes a long time. Depending on the area where you're having this done, you may have to hold your breath for a certain time. So it is a little bit more involved with patient involvement. You have to lay very still, obviously, for both of these, but because the CT is so quick, that may not be as much of a factor as it is for the MRI. But people who are claustrophobic may also have trouble getting into that MRI scanner. So that's always something to take into account as well with your patients. And then this as well, you need to make sure that you have consent signed from your patient in addition to that CT if they're doing a CT. Cerebral angiography is really cool. I wish I had a picture or a video of this. There may be a vascular lesion or a tumor suspected there, so they may do this to find out or to actually look at the blood flow. So you have the catheter. It's a big catheter, goes through that femoral artery up into the areas that they're wanting to assess or to image, and they'll shoot some dye up in there. Okay, you can see if there's an abscess, an aneurysm, hematoma, an AV malformation, arterial spasm, if there's tumors or lesions present there. But very important because we want to monitor for that anaphylactic reaction to any type of contrast media. Their groin site, think about that. Obviously, if you palpated or felt for your femoral pulse right now, you would feel a very pretty darn good bounding femoral pulse. So just imagine pulling out a catheter from that area, you really want to be very careful and assess for bleeding in that groin site. They're very specific on how they do that. It's all by protocol. Every 5 minutes for so long, you're going to be checking that groin. Every 15 minutes, every 30 minutes, every 60 minutes, until you've probably been looking at that person's groin for for so many times in 6 hours. So bleeding is huge with this, okay? Good test question. EEG, electroencephalography. That's kind of where they're you can compare it to, I guess, to an EKG because you're looking at electricity, but it's electrical activity on the surface cortical neurons of the brain, and they put little electrodes on there, and it's really helpful finding out if individuals are suffering from a seizure disorder. You can use it during sleep disorders to monitor that, and cerebrovascular lesions and brain injury. The most important thing is it's non-invasive, okay, but they do lay with cords running off of their head for quite some time. Then we're down to electromyography and nerve conduction studies. So EMG, it records the electrical activity associated with the innervation of the skeletal muscle. So you may have someone who's having a little slowed reaction time, and they're going to test and record the depolarization wave that's going to happen with that. Okay, that's kind of cool. And then this last, I think it's the last one here. I'm not keeping up with my paper notes here. Evoked potential looks like it's the last one, and that's the recording of the electrical activity associated with nerve conduction along sensory pathways. And those electrodes are placed on the scalp and then on the skin, and latency nerve conduction is measured. Okay, so that says here in your text, it does point out that that's really helpful in assessing visual or auditory systems as evoked potential. It's kind of cool. I think there's actually some pictures in your textbook of that as well. So, okay, that's it for the nervous system and the neuro lecture. If you guys have any questions, like I said, please contact me. If you have any comments, if whatever, just go ahead and leave them for me. I guess since we're going to try to put this on YouTube, I guess you could leave the comments there. That's it. Thanks for listening. Hope it helped.